Friday, when we signed the statewide prescription drug monitoring program, we let you know that was just the first step in our effort to address the opioid epidemic here in the state of Missouri. Today, what we're doing is we're saving lives. And last Friday, I signed a bill so that anyone in the state of Missouri, and we've heard from teachers, from principals, from church group leaders, from youth group leaders, that they want to have the ability to purchase Narcan in case they have a child who overdoses, so that they can actually save lives. We also signed an executive order today making it the policy of the state of Missouri that our law enforcement officers, our first responders, are going to be able to carry Narcan, and we're providing equipment and training to them so that they can go out and save lives on the front lines.
What's so important about that, Governor? Equipping your officers and your first responders with this?
You know, this is so important because we know that we can save lives. We studied what's happened in other states, and the fact is Narcan has helped to save over 10,000 lives around the country. 10,000 lives. And this has happened in other cities and in other states for a long time. They've been able to do this. But for too long in the state of Missouri, people talked about this problem without ever taking action. That's why we're so proud to sign this bill on Friday and to sign the executive order today, so that now our law enforcement officers, first responders, and others can be saving lives. Yes, sir. Yes, sir, please. Yes, sir.
So do pharmacists and other doctors, do they have access to the database, or can you talk about how the database actually works and who's allowed to use it and access it?
Yes, sir. So the point of the prescription drug monitoring program is to really get at the source of the opioid problem. And so our Department of Health and Senior Services is going to be able to look at every doctor who's prescribing in the state of Missouri. And using sophisticated data and analytics along with our private sector partners, we are in this innovative program going to be able to really look at the source of the problem, so that when we have doctors who are prescribing and overprescribing opioids in a particular county or for a particular patient, the Department of Health and Senior Services can address that problem directly. And they'll have several options available. So they can refer to law enforcement and the Department of Public Safety. They can, through the Board of Healing Arts, actually take action to even take away a doctor's license. Or if we've got a doctor who's overprescribing just because they don't know how to properly prescribe opioids, they can provide corrective educational measures. Yes, sir.
So
Please.
I think Senator McCaskill kind of criticized you about not having pharmacists or doctors be able to have access to these. I mean, do you think, I know there's some privacy issues with medical, information getting out there, but do you think that that's an important step to have them have access to that, or?
Look, there are a lot of politicians who always criticize people who take action. I was sent here as a Navy SEAL, as a conservative, as an outsider, to take action, and that's what we're doing. And we're taking effective action. Everybody knows that the doctor shopping problem is a problem where addicts will go and they know which doctors to go to, right? What we're able to do with our prescription drug monitoring program is actually target those physicians who are overprescribing opioids and who are really at the root of this problem. And so we're all about getting results, and I'm excited about the fact that we're going to be able finally, now that Missouri has joined 49 other states and we have a prescription drug monitoring program, to get results and to save lives.
The the Missouri State Medical Association had the same criticism, and they were concerned that they had not talked to you about this program beforehand. So the doctors organization is also concerned about that aspect.
I'd tell you, we've actually worked with health professionals all over the state of Missouri, and I'm not sure about this particular group where you're mentioning, but we've worked with health professionals all over the state of Missouri. Dr. Williams has on an almost daily basis. I've been working with them. Our team has been working with them, and we know that if we're going to effectively address this opioid crisis, which has now killed over 900 Missourians last year, if we're going to effectively address this crisis where for every 100,000 Missourians, we've got 89,000 prescriptions for narcotics, we have to have an effective prescription drug monitoring program. And this is an innovative, integrated, and comprehensive model that's going to help us to address this problem right at the source. And when there are physicians who are overprescribing, our Department of Health and Senior Services is going to take action.
The Steve Stanger was concerned that this would compete or confuse with the St. Louis County program?
We welcome everyone who wants to join our effort to combat this crisis, and this is actually complementary to efforts that counties and municipalities might undertake. And even today, in the program that we're doing, where we're rolling out this executive order and the law that we've signed to put Narcan out there, we want to work with counties. We want to work with law enforcement officers. This is not a Republican or Democrat issue. This is a problem that affects people all over the state of Missouri, and we have to find ways to come together, to work together to save lives. And I appreciate people joining our efforts.
Can you speak to the rollout of how this Narcan thing is going to go?
Yes, sir. So this law was signed on Friday. On August 28th, anyone in the state of Missouri for the first time will be able to go in and purchase Narcan. And again, we've heard from a lot of church group leaders, a lot of principals, school resource officers that they wanted to have the ability to purchase Narcan. So now on August 28th, anyone in the state of Missouri will be able to purchase Narcan. Immediately, what we've done today with this executive order, it's become now the policy of the state of Missouri that our law enforcement officers, our members of the Missouri State Highway Patrol, our park rangers, our conservation agents are going to be trained in how to use Narcan, and we're going to make sure that using a $5.5 million fund through the Department of Mental Health, we're going to actually be purchasing this and working with them. We're also immediately going to be working on expanding that training out to local law enforcement. So our director of the Department of Public Safety, Drew Druden, is going to be working with the Missouri Police Chiefs Association, the Missouri Sheriff's Association, to make sure that first responders and law enforcement officers across the state of Missouri get the support that they need so that we can all save lives.
So just so we're all
Yes, sir. Yes, sir, please. Yes, sir.
Do you basically, bottom line, do you think this approach is going to be more effective to the solution as far as other than the pharmacists and doctors getting that information? Just to kind of clear it up one last time.
We're all about getting results. What we're doing is about getting impact and saving lives. And one of the aspects that's innovative about our program is that by working with private sector partners, using the data that they have and the analytical capability that they have, we can literally, with a touch of a button, identify if there is a prescriber, for example, in a particular county who's responsible for 80% of the opioid prescriptions. That's a critical tool that's going to help us to get at the source of this problem. And for us, this is all about getting results. What we did yesterday with the prescription drug monitoring program, it's about getting results. With the executive order and signing this bill to make Narcan available, it's about getting results and helping us to save lives. And the fact is, we're not done. We're traveling all over the state of Missouri this week to talk about different things that we are doing in order to address this problem, because this is tearing apart communities. And behind every one of those statistics, there is, as you saw today, sir, there is a family that has been impacted by this, and we're committed to saving lives.
Would you
Yes,
like
sir.
to see more counties sign up to the St. Louis County PDMP?
I would love to have county leaders, sheriffs, police chiefs across the state of Missouri join our effort. There are lots of things that we can do together, not just in the prescription drug monitoring program, which is very important, but also in making sure that life-saving medication like Narcan is available. And as I just mentioned, we'll also today, as we travel this week, as we travel around the state of Missouri, be talking about other things that we're doing to address the opioid epidemic. So absolutely, we welcome everybody's efforts in this.
So you'd like to see more counties join in?
Yes. Yes, ma'am.
How is
Yes.
the PDMP different from what DEA is already doing, Medicaid enforcement is already doing to crack down on pill mills and track prescriptions?
So this is a different program. This is for the first time in the state of Missouri, a prescription drug monitoring program that is statewide. And what we're going to be able to do is, by working with private sector partners and the data that they have and the analytical capability that they have, we are, for the first time in Missouri's history, going to be able to look at prescribers across the state of Missouri in order to identify the source of the problem.